Hey everyone, we've gotten through yet another week and infection rates are rising. We've got a lot of news to get through today, so let me start. Okay, we've gotten reports of federal infection control surveys in Kentucky buildings. Um, and these are from surveyors from other states, such as New York. So if your facility has undergone a federal infection control survey, please let me know so that we can share your experience with other folks. With regard to the Inspector General update, this is really important. All facilities need to participate in the CMS infection control module trainings. And I'll talk about this a little bit more here in a minute with the CMS update, but instructions on how to access this training are available below in this update. All right, a reminder, due to the increase in cases within Kentucky, the Inspector General is going to be postponing certification or your annual surveys until further notice. We've gotten a few questions on that in this last week. Another update that came out from the Inspector General, we've talked about this a little bit before, but they've kind of named this, so I wanted to go over this, and we've received some more information this past week. The FAST teams, they call it the Field Administrative Support Teams. These are along with the nurse strike teams. They're going to be using the National Guard personnel. This will be starting next week. They're going to have 5 teams of 5 individuals in the coming weeks. Then it'll be increased to 10 teams. There will be a team in each region. However, if a particular region needs more than one team, that could be arranged. These folks are not going to be clinical in nature, but they'll be available to assist with administrative duties, reporting, monitoring. They can do things, and I've listed below in this update some of the duties that they can be used for, and some of the duties that they cannot be used for. So just pay attention to that if you get one of these support teams. The deployments usually last for 2 weeks. I suppose if you are going to need them longer, that can be arranged as well. You will, if you need one of these teams, let us know, or you use Web EOC just as you do for the nurse strike team. And then, like I said, scope of duties we've outlined here in this update. All right, CMS update. CMS went ahead and released the list of the nursing homes that have participated in the COVID-19 training. They've also issued an urgent call to action for every facility, every licensed facility, CMS licensed facility to participate. So they've recognized the 1,092 nursing homes which have 50% or more of their staff completing this CMS training that is designated to help staff combat the spread of COVID-19. This training includes modules that emphasize topics like infection control, screening and surveillance, personal protective equipment, disinfection of the nursing home, cohorting, this famous red, yellow, orange, and caring for individuals with dementia during a pandemic. You all participate in this training. If you haven't already, please, please, please do. CMS developed this training in consultation with the CDC, and it was released in August, at the very end of August. It's free to access on the CMS website. We understand that your staff is very taxed at this time, but if you can just designate, just set aside time for at least 50% of your staff to participate, that would be tremendous. Okay, some other news. CMS or state surveyors will be calling nursing homes who report new cases, which is most of our facilities, or facilities who report shortages of PPE or staff. And we hope that they're going to be offering assistance of some sort. So if you receive one of these calls, please let us know about what that call, consists of. We've heard some of those questions, and I've listed them here in this update, just so you know, if you haven't received one of those calls, you know kind of what to expect. But if you do receive one of those calls, please let us know so that we can report out to everybody else. All right. CMS also issued an update of guidance for Medicare Part A, SNF, PPS, PDPM claims. And I'm sure Wayne would have more information on this. But they posted a change request transmittal that updates the SNF patient PDPM claims processing instructions. Just take a look. If you have any questions, please let us know. The effective date is April 1st. The implementation date is April 5th. but the application of the claims processing edit is retroactive back to October 1st, 2019. Because this is a systems update and not a policy change. So I'm sure Wayne is the expert on this information, but I'm just kind of passing along any information that I get. All right, an NHSN update, our favorite system. A reminder, Medicaid licensed facilities using point of care testing devices have until November 20th to start reporting point of care antigen test results to NHSN before CMS starts exercising enforcement discretion. However, this is really important, and I want to start stressing this to everyone. At this point, I would recommend that every provider across Kentucky move forward with obtaining this access through NHSN. This requirement comes from this requirement for Medicaid licensed facilities comes from an updated June 4th Health and Human Services memo on lab testing. However, like I said, I would recommend, based on information we're getting from the cabinet, that everyone go ahead and start accessing this accessing this access. Been a long day. But go ahead and start obtaining this level 3 access in NHSN. To access this new reporting module, facilities must upgrade from SAMS level 1 to SAMS level 3. Now, CDC does estimate that it's going to take about 3 weeks to upgrade. We've been talking about, for those Medicaid certified facilities, we've been talking about this for a while. Most of you have already done this, but for those of you who are not Medicaid licensed facilities, this is going to be new information. So go ahead and get started. We do understand for some facilities there have been delays in this process. So you might miss the November 21st deadline. For those of you that are CMS licensed, they know that CMS is aware of that. So please just keep any type of proof that you have, any emails, efforts that you've made to meet that November 21st deadline. CMS CLIA inspectors will take all of that into consideration as evidence that you're making efforts. And instructions on how to upgrade to SAMS level 3 are available in this update. So if you have any questions on that, please don't hesitate to reach out, and myself or probably anybody with the association can help walk you through that. All right, an OSHA update. OSHA released a one-pager on frequently cited standards related to COVID-19 inspections. They encourage employers to learn about OSHA's on-site consultation program that is available for free to employers and provides confidential OSHA services for both small and medium-sized businesses, which I would imagine applies to most of us. Additional resources are on OSHA's page via the AHCA site available in this update. So click on that and please access any of resources that are available to us. This includes a respiratory protection program template. Sorry, my nephew's upstairs having a meltdown. All right, AHCA's update. HCA held a call with CMS Administrator Verma, and there is a whole outline in this update that goes over all of the notes, but just the probably the most important highlights for you all, and you can go review that outline. But for anybody unable to participate, SNFs and ALs need to be prioritized for that vaccine, the COVID vaccine that's going to be coming out. She's aware of that, and that's why she talked about the partnership with Walgreens and CVS, and additional pharmacies. And she also indicated that most skilled nursing facilities and ALs have signed up for that vaccine distribution. Allocation of those vaccines will be given to each state, and then the state will decide how the vaccines will be delivered out to who and where. She did explain that vaccines are most effective when given to individuals with mild symptoms. That was news to me. I didn't understand that. I thought it was going to be a preventive vaccine. So it's interesting. And she did explain that it does well with elderly and those with comorbidities. So it's developing information. We will clearly send more information on to you as we learn more. We also learned that CMS, we've heard rumors of this, but it's, again, more developing information. CMS will be putting out holiday guidance. I'm not exactly sure when. Next week is Thanksgiving, but CMS will be putting out holiday guidance. She expressed concern about staff and residents leaving nursing homes and then coming back. But we are still anxiously awaiting this holiday guidance from CMS, and I'll be anxious to see if it's a mandate or recommendations. Finally, I've included information on Kentucky's positive cases and some predictive modeling. It's just for you to take a look at. It's just really interesting to take a look at. So it's not anything, really necessary, but because you all know you're living it every single day. But I just wanted to include that for your information. As always, if you have any questions or concerns, please don't hesitate to reach out to us at the association. We're here to support you. So have a great weekend, and please get some rest and stay well. Thanks.